aging. I say it is a privilege. India will be a grey nation before it becomes a rich nation. This happens so gradually. The loss of functionality is so gradual that one tends never to feel it. Gradually, you lose your vision and get a chashma. It's very gradual. It doesn't happen one day. Exactly in the same way, now in elders, before prescribing any drug, we do have to look into the kidney function. If that elder's EGFR is less than 45, the drug is probably going to remain in the system for a longer period of time. So the dose will have to be adjusted.
Hello, thank you for tuning in. If you want to come back to this video later, just tap on the like button. It will save it to your liked videos so it's easier to find. And don't forget to hit on the bell icon to get notified whenever we drop new content. Stay curious, keep learning, and see you on the inside.
Namaskar, good evening, all of you. And today's topic given is maintaining functionality for healthy aging. So there are two issues here. One is functionality and one is healthy aging. We will touch upon both of them as we progress. I bring to you greetings from the Aged Care India, the Mera Swasth Physicians Network, the Indian Medical Association, the Age Friendly India Initiative, and the first OPD for Elder Care Fortis. These are all the places that I'm associated with. Well, aging. I say it is a privilege. Is it a privilege because we are in our country hearing कि हमारी सभ्यता से बुजुर्गों की सेवा करना? Or is it that we are seeing and encountering many more aged persons today? Well, let us try and understand the importance of why we are wanting to talk about the elders. Aging population in India. India is an aging country. Why do I say that? Because according to United Nations, if a country's 7% population is above 60 years, it is called an aging nation. India already has 9 to 12%. So we are an aging nation. And according to the UNDP report 2023, the share of 65 years of people and above will double from 10.7 to 20.8 by the year 2050. And by the end of the century, the 60% and above population will constitute 36% of India's population. And by approximately 2040 to 45, the population of people above the age of 60 will be above the number of children below the age of 15. Within this rapid aging is this phenomena of feminization in aging. What is feminization in aging is if you see the pink vertical here, the pink horizontal line and the blue horizontal line, you will see that they are close to each other. As you go up the age ladder, come to around 75, 79, the pink line is longer than the blue line. Go to the bracket of 85 to 90, see the pink line much above the longer than the blue line. This phenomena of aging feminization is resulting in more females as widows than their male counterparts. This is going to have major social implications. There will be long periods of widowhood. There will be longer periods of chances of social isolation. There will be more cases of neglect, abuse, exploitation, and violence against the single ladies. There will be a higher chance of financial dependency. And as medical professionals, there is a hostile system existing for the elderly ladies especially, and therefore they will be denied accessibility to good quality care because of the social structure built around them. So therefore, ladies and gentlemen, what I say, that India will be a grey nation before it becomes a rich nation. What are the consequences as India ages? Kindly go through a paper which is available on Google. It is called the Position Paper on the Elderly, published by Niti Aayog in February 2024. What does it say? Out of this large population of elders, a large population is going to be dependent in one way or the other, physically, socially, financially, emotionally, and they will be vulnerable to contracting or developing various diseases, both communicable and non-communicable. Therefore, a major sizable population of society will need support, maybe for life. Then there is another social change that is happening simultaneously. While the numbers of elders are going up, the dwindling caregiver support, the number of children going away from homes, they are going abroad. So therefore, the caregiver support for the elderly population is going down. And therefore, the elders will have to fend for themselves with whatever resources are available to them. So therefore, let me talk to you about the challenges of the elders as they go through their journey. It is maintaining health, ageism and abuse, self and long-term care. So these are the three major challenges that the elders are going to face as they grow. Elders, when they face these challenges will be seen and felt differently by elders. They will be faced and solved differently by elders because the circumstances are not similar for the elders. So the same set of challenges is going to evoke different responses from different groups of elders. But remember, one thing is certain. In order to overcome these challenges, their age is not going to be a factor. Their age is not going to be a factor which is going to determine how they will face these challenges. Then what? If age is not going to be a factor, then what? The one single factor that is going to matter for them is their functionality, not their age. So, functionality. Everybody is aging. It is commonly said age is just a number. But what age are we talking about? When we say age is just a number, which age? We have a chronological age, which is based on your date of birth. हर birthday पे आप एक साल बड़े हो जाते हैं. That is your chronological age. Then we have a vascular age. How old are your arteries? So you may be 45, but your arteries may be 65. And that is why we are seeing young people get heart attacks. So if somebody is 80, are his arteries 80? Or maybe his arteries are 60? Possible. And the third is functional age. So functional age is based on the level and the qualities that what a person is doing. That is functional age. And functional age is a combination of chronological age, biological age, and psychological age. These three constitute the functional age of an individual. And it is functional age that is going to determine how healthy you are going to be as you age, not your chronological age. That is the big paradigm change that is coming in elder care. So we don't judge or care about an elder based on his age. We decide based on his functionality. And that's what functionality is important. It is functionality that is going to help a person go through the journey of his life, which is healthy aging. And functionality in the elderly refers to the ability of people to perform daily and social activities. That is one criteria. The ability to perform daily and social activities, and remember, and to be and do what they value. So functionality will ensure that an elder lives the way he wants to, becomes somebody who wants to, and therefore the goal of successful aging is to preserve function and remain independent. So if you have a particular level of functionality this year, the goal of every elder will be to maintain that functionality till next year so that he remains independent. That is healthy aging. So functional age, a very important aspect of functional age. Please remember, chronological age which occurs at a universal fixed rate, it is 1 per year. हर साल 1 साल उम्र बढ़ती है. It is fixed. Functional age, which is turned in functional age, it is non-chronological because its rate may accelerate or deaccelerate. In fact, functional age may be greater or lesser than somebody's chronological age. As I mentioned, if somebody is 80, his functional age could be of 65. That is why you see so many people at the age of 80 still working very hard. Prejudiced mind will say, अरे 80 साल का आदमी इतना काम कर रहा है. It is not his age. It is his functionality that is making him work. And that is what is keeping him healthy. So functional age reflects how well you and your body and mind are functioning together compared to your age. So even at 80, how is your mind and body working together? That is functional age. So remember, the functional age has totally different criteria. And unlike traditional age, the functional age captures your physical and cognitive health. So physical health and cognitive health, both together combine and decide what is your functional age. Why is functional age important? Because functional age comes into play into every aspect that will determine quality of life. If you want to live a quality of life, the only single criteria is your functional age. So quality of life will depend upon a person's functional age, not on anything else. So when I'm talking so much about functional age, I'm sure the question arises, are we able to tabulate functionality? Are you able to measure functionality? Yes, you are able to tabulate and make an assessment chart of functionality. So assessment of functionality of an elderly person can be conducted at a number of different levels and using different methods. In fact, assessment of overall functional capability is the central theme of elder care. When we talk about elder care, the functional part is assessment of functionality. And I'll just, for example, before I come into how functionality is assessed, let me give you some examples of day-to-day occurrences which are limitations in our function, but we don't realize it. For example, me wearing my chashma is a rehabilitation of a limitation. After all, cataract की वजह से मेरी vision को limitation हुआ. I corrected it by my cataract surgery and now wearing glasses. But people don't realize that chashma is limitation of a functionality. Your field of vision may go down. Similarly, hearing, it is decreasing of your functionality, but it is taken just as part of aging. इस उम्र में तो होता ही है. No, sir. It is decreasing the functionality, and these are common areas. Walking slow, walking with a walking stick. All these come into functional limitations which are accepted in day-to-day life. So I'll now briefly mention about how functionality can be assessed. Now, functionality is assessed under 5 domains. There are 5 domains under which we assess functionality: the physical, cognitive, emotional and social, environmental and technological, and nutritional functionality as the last one. I'll just briefly touch upon what is physical functionality. Mobility, balance, strength, endurance. Let me say a word of caution here for all medical professionals. When people are visiting a doctor for their regular consultation, seldom is functionality ever assessed. Imagine somebody going for a cataract surgery. Does the ophthalmologist ever check the functionality? No, because he's only interested in his eye. Interested means within inverted commas, not as a prejudice statement, but because that's his field. But every elder visiting any specialty should be assessed for their functionality. So physical functionality is, the parameters are mobility, balance, strength, endurance, and the common challenges, medical challenges that can aggravate the deterioration of physical functionality are arthritis, osteoporosis, decreased muscle mass, and chronic illnesses. So if I have an elder who has osteoporosis, I will make sure that I test his physical functionality before deciding his treatment. And there are assessment tools which can help a professional assess the functionality. Gait speed. There are charting with activities of daily living and activities of the daily living and instrumental activities of daily living. These are the two types of activities. So you find out how much is he able to bathe by himself? Is he able to drive by himself? So these are instrumental using daily activities, and then there are non-instrumental use of daily activities. You can assess them, you can chart them. आप चाय अपने आप बनाते हैं कि नहीं बनाते? It is just tabulating them. So we have physical functionality. Similarly, you have cognitive functionality. Now remember, memory loss is just one part of cognition. Memory is one part of cognition. When we say somebody's got memory loss, it may just be that he's slowing down. His processor, we all are using computers, we all have a processor. How soon the processor decides multiple tasks, chai banana hai, yahan se chai uthani hai, patti uthani hai, pani uthana hai, gas. So there is multiple actions based on your eyes, your hands, and your memories. All three have to be combined for one action. So this processor, if gets delayed, it can lead to decrease in cognition. And there are tools to find out this. It is called the mini mental state examination or the Montreal Cognitive Assessment Chart. These are international charts, ladies and gentlemen. You can access them on Google. So find out, use the chart, assess a person for cognitive functionality. Emotional and social functionality. Geriatric depression scale. There are scales to find out about loneliness, social isolation. These are the parameters. These are the important tools to find out. These are the parameters of emotional and functional stability, health. Then there are environmental and technological support. Importance of safe living environment. If you assess an elder's house, see how safe he's made it. Has he got fire alarms? Has he got good doorbells? Is he using cameras? It is going to be depending on his functionality to be safe. ऐसे ही जिंदा रहना है. He will not take part in safe environment. Then a very important part has come into technical functionality is using of mobility aids. Watches gives you a pulse rate, gives you abnormal pulse rate. Are the elders being able to use it? It is called digital functionality. How much of work are they doing on their telephones? How much are they accessing computers? How much are they ordering on Blinkit? How often have they got into trouble? So digital functionality. Niti Aayog has laid a lot of emphasis on digital functionality. And lastly, nutrition, balanced diet. So many elders have B12 deficiency, mostly because of two reasons. They tend to become vegetarians. They lose their teeth, so they tend to start having soft items. And nutritional deficiency of B12 leads to demyelination and cognitive decline. So malnutrition, dehydration, very common in elders. Now, as common medical professionals and as society there is a mindset which a lot of society has. What are the challenges to functionality? It is because society has made in a frame, and you close your eyes and ask somebody, okay, 75-year-old person, describe him. And 7 out of 10 times you hear the person say, grey hair, stooping back, slow walk, trimmer hands, disconnected with the surrounding, बैठे अकेले बैठे कहीं देख रहे हैं, listening to bhajans. It's considered part of aging. Unpressed clothes. We have made this impression in a frame. Okay, this is how a person elderly looks. That is not so. Because of this fixed mindset, we tend to start saying, ये तो होता है इस उम्र में. So, कपड़ा प्रेस नहीं किया, अरे इस उम्र में क्या कब प्रेस कराना है? It gradually leads to loss of functionality. When they say such things, they are trying to indicate that this happens with age. Sorry, it does not happen with age. And they tend to start accepting a poor quality of life. Unfortunately, it is not the age. It is gradual loss of functionality which is at the root of the problem. And this happens so gradually. The loss of functionality is so gradual that one tends never to feel it. Gradually, you lose your vision and get a chashma. It's very gradual. It doesn't happen one day. So checking your functionality is the only way to find out. And please recheck it every year. Every year. And you have good assessment tools to find out these domains. Make a chart, give it to the elder and say, this is your functional age. Next year, when you come on 24th of December to celebrate Christmas with me, see to it that these are maintained. And I always close by saying that elders definitely ask me once in a while, is coffee good? So my answer always is, it is good as long as you have it with me. Thank you very much for your patient hearing. Thank you. Dr. Barsha, if you can, thank you so much for your patient hearing.
Thank you, sir. We do have some questions from doctors. So one of the questions that we had from Dr. Kulkarni, sir, was why old age homes are increasing day by day, marks place, and how to eradicate.
No.
So your comments on that?
Yeah, I disagree. Old age homes are not increasing. In fact, WHO has announced aging at home. They are increasing because there is refurbishing of elders' houses. It is called refurbishing. So if I'm an elder and I'm staying alone, today real estate people are coming to me and saying, okay, we'll build your house. You stay in one floor. We'll make the other floors. And they are getting income, they are getting. That is happening a lot. It started in Bangalore and Chennai. Old age homes are usually coming up for the destitute or those elders who unfortunately are left on the road or left by their family people to die on the roads. Voluntarily, very few people are opting to go to old age home. The homes that are started by some companies are exorbitantly expensive. They are something like around 1.5 to 2 lakhs a month. So for the average elder, it will be aging at home. And for aging at home, maintaining the functionality is going to be the key.
Thank you, sir, for taking in our question. Also, I would also like to say that there's a lot of appreciation from our doctors. Dr. Patil says, great session. Dr. Mahadev, sir, says, excellent session. Thank you so much,
Dr. Desai.
And also, Dr. Desai, sir, has opinion like we'd love to learn a full session on prescribing in elderly.
I'm so glad this question of prescribing in elderly is being asked. Thank you, Dr. Desai, for this lovely question. It is not that like we used to have in pediatrics some 20 years ago, half the tablet de do, आधा चम्मच de do. What turned out? They now say 0.2 milligram per kilogram body weight. Exactly in the same way, now in elders, before prescribing any drug, we do have to look into the kidney function. If that elder's EGFR is less than 45, the drug is probably going to remain in the system for a longer period of time. So the dose will have to be adjusted. In elders beyond 80 years of age, HbA1c of 8 is also acceptable if the microalbumin urea is less than 30. So you're absolutely right. Prescribing in the elderly is not same as before.
So we have a question from Dr. Madhav sir. Is senility a cause for tremors?
Well, tremors are of two types. One is a tremor not of senility. Senility is a little judgmental word, but you have tremor because of poor muscle mass. But the tremors of Parkinson's are not because of any muscle weakness. They are because of spasm of alternating groups of muscles. So you have once this group which is in going into spasm. So you have the hand turns there, and then you have this group that turns the hand back there. So it is because it is small muscles. So that tremor is because of alternate muscle fasciculations because of dopamine deficiency. So therefore, that is different than the tremor which is of aging, because in aging tremor, it is not a functional. It is in Parkinson's tremor. When you start to work, you start getting a tremor. When you're at rest, you will get a tremor. Whereas while you're aging, once you're working, the tremor comes down. That is the difference.
So the next question from Dr. Tripathi. If you could enlighten on the common exercises for elderly at home.
Dr. Tripathi, I would just simply say it's a very important question. It is important for all elders to do their exercise while sitting on a chair. It is important for elders to have weights in their hand and put up the hand with a weight in their hand and hold the hand with straight elbows. So it is holding hands with weights that is important for elders, hands and feet, both. How to avoid polypharmacy? Dr. Said, very good. The way to avoid polypharmacy is maintain electronic medical records for elders. So that every time an elder goes to either an orthopedic surgeon, please note it down. He goes to an ophthalmologist, note down the medicine. The best way to avoid polypharmacy is always ask your elder to bring all the prescriptions, including his ghar ke nuske wali dawaiyan. Don't miss them out. A lot of them have polypharmacy having vitamins. You'll see B12 levels of 4,000 because they're having 7 different types of B12 in 7 different tablets. So please always ask for all the prescriptions and all the medicines they are having. Ask them to bring all the dabbas in front of you. Sarcopenia is addressed in elderly. Yes, sarcopenia, Dr. Said, is loss of muscle power and is an important cause for frailty. And sarcopenia, the way to address sarcopenia is to look after osteoporosis, and weight resistant exercises will control sarcopenia. Weight resistant, not otherwise. I call these elders, I tell them, ye to aapke exercise sirf kabutar uda rahe ho. Take weights and then do the exercise.
The next question, Dr. Singh. Sleep issues are significant in the elderly.
Yes, sleep is very important. And in elders, what is important is they should be always encouraged to have fixed timing of sleep. If it's 9:30, make sure that every day they sleep at 9:30. Regularity in keeping the time brings back their circadian rhythm and improves hormone production early morning. And 100% avoid benzodiazepines, Alprax, Plana, Damkana. They get so bad because there's rebound anxiety in all elders who have so much of these sleeping tablets.
Dr. Panwar asks, will you advise yoga and meditation at 75-year-old?
100%, 100%, 100%, definitely. But I would suggest not to start yoga on your own. Please take advice of which are the asanas which you can do. Meditation in elders, meditation is breathing meditation. The Anapana meditation, which is on Google, you can read Anapana meditation. Practice that.
So Dr. Desai has a question. So do you believe in aspirin and statin routinely for primary prevention?
Not aspirin. And nothing called routine. You have to assess the risk status of an individual and then prescribe preventive medicine. If the risk status, if somebody is 80 years old and is non-diabetic and has no microalbuminuria, you could do away with no need for aspirin at all. You could just put statin.
Next is from Dr. Alam. When can we start drugs for Alzheimer's disease?
When can you start? Well, the moment you diagnose Alzheimer's. There's no preventive medicine in Alzheimer's. Alzheimer's is only one of the types of memory loss, cognitive decline. It is one, and it is the commonest type. That's all.
Next is from Dr. Yashwant. Patients do complain of vertigo and ringing sound. How do we manage that?
You will seldom have vertigo in an elder. True vertigo, because vertigo, which is with the middle ear, it is usually because of weak cervical muscles, and it is managed not much with medication, but more with exercise and supportive medicine. Usually it goes off, it doesn't matter. And ringing sound, if somebody elder is complaining of ringing sound, please get a hearing test done.
So taking in the last question for tonight from Dr. Shanti, geriatric depression, how do you prevent that?
How do you prevent? Maintain functionality. Your social and emotional functionality will make sure that you are preventing depression. If you are socially and emotionally functionally fit, which means to say, as an example, you are still willing to meet new people. You are still willing to experiment, to talk to somebody whom you don't know from before. That is social functionality. And emotional functionality is when your reaction to a situation which requires emotion is not one of extremes. Suddenly you start shouting, get out of the house and things like that happen. That is not emotionally functional. So the way to avoid depression is to maintain good nutrition, a good level of B12, good physical exercise, and social and emotional functionality. Thank you very much.
Thank you, sir, for taking in questions from our doctors. It was really great to have you back on Medflix, and thank you so much for this session.
Thank
It's
you.
a very important topic. And so, any closing remarks, sir?
Thank you. Thank you. Thank you.